بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. Thank you very much. After I say the first two nice lecture about hydatid cyst, I will consider this lecture as a review. I start this lecture really before 20 years as I was a student in Baghdad, where the hydatid disease is very high. At that time, I had no idea about the hydatid disease in my country, Yemen. Hydatid disease primarily affect the liver and typically demonstrated characteristic imaging. Many potential local complication, example intrahepatic complication and exophytic growth, transdiaphragmatic involvement and peritoneal seeding, biliary communication and others. Secondary involvement due to hematogenous dissemination may be seen in almost any anatomic location. Example, the lung, which consider the second place for hydatid disease, kidney, spleen, bone, brain, and spine. I have one example for the involvement of the spine, which is, I think, the last slide. The definition, echinococcus or echinococcus or hydatid disease result from being infected with the larva of a developing phase. I don't know if it's correct to say infection or infestation, but both of them will give the same meaning. And there is three types of echinococcus: Echinococcus granularis and Echinococcus multilocularis and Echinococcus vogeli, which is only in South America. Sources of infection or infestation. Echinococcus granulosus is found in most commonly in dogs. Of course, you know that the contamination is almost come through the ducts, because the duct is the most animal which have very close contact with the simple people, and of course with the high level people even in our countries. Echinococcus multilocularis is found in fox, dogs and cats. And the last one, the vogeli, we have no lot of idea about it because it's only reported in South America and we have no such type of echinococcus. Infection with Echinococcus granulosus result in the formation of cyst in the liver, lung, kidney and the spleen, which is cystic hydatid disease. And the other type is infection with Echinococcus multilocularis result in the formation of parasites, tumors in the liver, lung, brain and other organs, which is alveolar hydatid disease. This is here the histological appearance of the hydatid cyst or Echinococcus granulosus. It's formed from three layers. First is the pre-cyst, which is the fibrotic reaction of the organ, wherever the organ, of course, almost in the liver. It is just fibrosis, and then of course, the endocyst, and then which is, of course, it is not the endocyst, but the cover of the cyst is ecto, and then the inner layer which produce the daughter cyst. And this is here the life cycle of the infection. It's come directly either from the feces of dogs or through direct contact with the contaminated animal. Humans are usually exposed to those eggs in one of two ways, I said before. And this is here just an example of a cyst. This cyst can be hydatid, and it can be just simple cyst. It can be even metastasis. How we can differentiate between simple cyst and the hydatid cyst? This is here will be in the next. First, I will start with the clinical symptoms appear by the patient who have hydatid cyst. Whatever is the cyst, the majority of the patient have no symptoms, and most of the cases discovered accidentally. Of course, you know that the liver is the biggest organ in the abdominal cavity, and some of the patients have symptoms like abdominal distension, little bit pain, discomfort, or they found that there is mass bulging in the abdomen. They go to the doctor and discover, of course, by the ultrasound nowadays. Before it was not easy like that. All the cases which I have here are my cases, and we have a lot of different type of the hydatid cyst in a different organ. From the complication which can appear, of course, the jaundice due to obstruction or compression or infiltration to the biliary tree. Rupture, which is of course one of the problem which can lead to a lot of complication. Rupture to the bile duct, to the abdominal cavity, to the peritoneal cavity, to the lung. This can perform as fever, urticaria, or serious anaphylactic shock. This can happen, of course, from the fluid of the hydatid cyst. The cyst occurring in the lung, about 20% is, as before mentioned from my colleague, is 20 to 30, and this is correct. This is reported everywhere in the world. Usually symptomatic if there is more than one cyst, or if there is any complication of the cyst. But if it's small and simple, is discovered usually accidentally. And the complication appear as shortness of breath, cough, and other manifestations. Pulmonary cysts are usually discovered in routine chest X-ray examination. I mentioned that before. How's the Echinococcus granulosus diagnosed? You know that the ultrasound, one of the best methods to diagnose the hydatid cyst, because it contains fluid. Not all cysts contain fluid, but most of the cysts contain fluid. And we can see that, of course, by chest X-ray. All new modality of examination, best, of course, after ultrasound, is the CT scan and MRI. This is here for us as radiologists and sonographers, and there is other method, which is, of course, lab investigation for the other doctors. The treatment, I will not speak about the treatment because it's mentioned before, and exactly is the same method, but I will mention for you one story when the first professor who mentioned or who classified the hydatid cyst was invaded by us in Yemen before 2 years. Is Professor Garbi. He was still the head of the ultrasonographic society, at least in Europe, and very well known person. And we mentioned that the surgery is the first choice of a treatment, and he told me that it's okay if there is any complication, if there is any big cyst, or if it's only one. But multiple cyst treatment is usually with medication. What we are doing really nowadays as ultrasonographers or radiologists, we try to aspirate the hydatid cyst, of course, with a needle. It's the simple needle like myelography needle. We take little bit, the gauge little bit big to try to aspirate as good as possible, especially if the content is thick or if it's complicated cyst. By very simple cyst, we can use even the 20, gauge 20. The best cyst to be aspirated, of course, re-injection is the simple cyst if there is no septine. But if there is symptoms, it is almost difficult, and we need time. Sometimes is not very successful. This is here the same method which is mentioned before from my colleague. Is what we inject really, there is different type of material which can be injected. And believe me, before 20 and 30 years, they inject formalin. And lot of complication. One of them is the anaphylactic shock, not from the fluid of the hydatid cyst, but from the formalin itself. The result of different material injection, really, it's reported as the same. What is the aim of injection of fluid? To kill the daughter cyst inside, to avoid complication. The puncture has to be just one puncture, and then to try to aspirate, not contaminate the other organ, because contamination can lead to other problem which is bigger, which is dissemination. It's like metastasis. Inject any hypertonic solution. Best is the normal saline. And re-aspirate, it is better if it's more than one time and almost without complication. The best is the superficial and big cyst. If it is very deep, close to the diaphragm or lung, almost be careful, don't start with those cysts. And I want to mention some of that classification, international classification, which is not mentioned before. This is good. There is simple cyst A and B. Simple cyst A without any symptoms inside, the other one septated. Multiple contagious cyst is the second, which consider even one of the simple cyst, and to be multiple septated, having solid masses inside. This is here the last classification, which is international classification. I found that the previous classification was easier for us because it was shorter, but this is here what they are doing now. The wall detachment is 3A, water lily appearance is type 3B, and the mixed pattern is type 4. Then the heterogeneous cyst is type 5A. Of course, the hydatid cyst can appear as a tumor mass lesion, as metastasis, as abscess. We saw before one of those examples. It can appear in a different way, but if you find more than one cyst, then be sure that this is here almost hydatid cyst. It can be, of course, infectious, other infection like amoebic liver abscess, but we know how to differentiate between the hydatid cyst and non-hydatid cyst. I have some of the example for the differential diagnosis. Will come later. Of course, the hyperechoic cyst, we found even two examples from my colleague. I will not show you again. And the calcified, which is the last, which is the seventh, A and B, if it's partial calcified or calcification of the whole cyst or the whole wall. This is the previous classification by Garbi and Carmini and Berdumu. The last one is from Carmini, but now what they depend on the WHO classification is type 1, 2, 3, and 4 depend, of course, if it's simple with symptoms or not. The other one is the clear laminated membrane or snow-like appearance. It's similar like hydatidiform mold. The type 3 it's multi-septated cyst, and